We have to create an instant bond or connection with this patient, projecting confidence. They're hoping to trust you in the first few seconds of the interaction. Robots don't do that very well, doctors do. That might be making note of the address you see on that registration card outside the door at the nurse's station, mentioning something from their part of the world, just simply extending a warm welcome to the clinic and our team working with the patients today. I'm Dr. Chad Brands with the Mentoring Docs channel. You're joining me, a medical student doctor and a resident physician. This is our first afternoon in the clinic together. Good to meet you. So here we go, off to room 2, where the new patient's waiting for us. Stop at the door. Use the hand sand scrub-in station right in front of us. We all gel in prior to this visit. Now, knocking on the door of exam 2. Don't expect any verbal enter. It's just a courtesy knock for the patient. Doctor, you are about to see, as we enter this sacred space as physicians, how we need to connect instantly with the patient. As the lead physician in this space, I make direct eye contact, warmly greet the patient and whoever is in this sacred place with the patient. I'm introducing myself first as I walk toward the patient, and you're coming right on behind, on my tail, closing the door behind us, private, confidential space. The patient is not in a gown. We're meeting new patients in their own attire, street attire, not those crazy hospital gowns. At the same time, I'm also introducing you as my colleague. First, as the senior member of the team, resident physician Dr. Toyle, and then student Dr. Reed, both working with me today. And I immediately want to know who's here with the patient. So I simply ask the patient, who's with you here today? I'm not going to guess. The patient will usually tell us. If unable, we're going to seek clarity from those accompanying the patient. It's even more important in pediatrics and geriatrics, when patients are often, but not always, surrounded by a number of family members, guardians, caretakers, social workers. They likely know much more about me and you at this point than we know about them. I use humor as a fast connect point. Anyone can talk about the weather, right? What could be that connection point for you as a medical student or a young doctor as you consider building out your repertoire of introductory soundtracks? Weather, location, humor. Those are the approaches that work for me. Thanking the patient for coming, bringing their beautiful family, and trusting their care to you and us as the fine team today. So here goes. I see you're from that spectacularly beautiful state of Florida, Mrs. Jones. It's always sunny, having lived there. Ah, those beautiful palm trees, blowing gently in the breeze. We could certainly use more of those beautiful beach times up here and that sunny weather as well, without the hurricanes. Put the patient at ease. The patient knows I've got a real connection going. Bringing laughter is good medicine. Moving on to the patient's chief complaint or the reason for the visit. Almost always, shocking, different from what they've told the team's staff. Think about it. Who's going to share a really important request or even their deepest need with someone who walks them down the hallway, busily gets them into the office for the first time? I wouldn't, would you? That's what the doctor-patient relationship's all about. We're trusted as doctors. The literature says so. So let's keep the trust going from the beginning of the visit all the way through to the end, starting with the introduction. If I know that I've been referred the patient by a colleague, I'm simply going to state, Dr. Bonecraft's going to be doing soon a new hip for you. And we've got a pre-flight checklist that we're going to do so that you can get this surgery off and running. Keeping it light alleviates the apprehension. Who wants to go to the doctor anyway? My grandmother always said, don't go to the doctor. They'll find something wrong with you. I clarify the reason for the visit or the consultation up front. And that's usually going to set clearly the agenda for the visit in motion. You're getting that new hip for Christmas. Santa Claus might be calling your daughter here to see if you've been good. Gets us started and aligned from the outset. Time is ticking in the office-based setting. We can't be here all afternoon. We've got patients to see. I'm going to inform the patient, therefore, that you, Dr. Toyle, the resident physician on this medical service, is next going to spend some time going through a number of items preoperatively. Then, just like a pilot directing the crew, I'm going to simply state clearly to the patient. Then Dr. Toyle is going to come find me while you wait right here. I'll be back in a few minutes, and we will go through all of your questions and review the information that you need to know pre-surgery for the best possible outcomes in the gifted hands of Dr. Bonecraft in orthopedics to avoid any unnecessary surprises. And I'm going to leave you entrusted, team, with the patient to fulfill those clearly defined deliverables. I just built you up. Don't let yourself, the patient, the family, or me down. Take it to the goal line, doctors. Run with it. Score the touchdown. Move the ball downfield. No delay of game. We'll celebrate the win later, 30 days post-operative later, when this patient does well because of our collective, excellent, evidence-based teamwork. Right now, you've got a lot of work to do in this exam room. And by the way, remember, don't turn on the computer screen. Address and listen to the patient. Wait a minute or two without interrupting. The patient's going to tell you and lead you to exactly the information that you need to know as you introduce yourself to make an instant connection and bond with that patient who's entrusted their care to you, as well as your orthopedic colleague, Dr. Bonecraft. And even more likely, that's going to build confidence in you and the entire healthcare system team from start to finish for what's been called this episode of care. It's time for you to lean in and be the difference for patients so that they can clearly see it with their family members and grow and develop into that caring, compassionate, competent doctor you're striving to be. Drop a comment down below, subscribe to the channel, and share these videos. For mentoring docs, I usually say stay well, study well, and today I'm saying be sure to connect well with your patients. You're going to become an even better doctor and one of the very best at the bedside.